I'm Mrs. Princey, Associate Professor in Mental Health Nursing. We've already learned the disorder, that is the dissociative and conversion disorder, wherein the person dissociates himself or separates himself into a different identity, which is termed as dissociative disorder, and conversion disorder, where the person is having a mental stress or a conflict. He converts a psychic conflict into the physical symptoms. That's what is called as the conversion disorder. Both these disorders occur because of the anxiety which the person is having. So let us see what is the nursing management of a client with the conversion as well as the dissociative disorder. The first thing in the nursing management that you're going to do is a nursing assessment. So in the nursing assessment, you're going to collect the information. That's what you're doing in the form of the history collection to rule out the cause of the disorder. So it can be related to the genetic cause, or it can be related to the faulty, psychodynamics, which is happening, poor ecosystem development, overuse of ego. So all these are the reasons why a person may develop this dissociative or conversion disorder. So you're going to find out the cause. So it's important that you collect the history from the client. The second thing is you're going to do the assessment, the mental status examination, to rule out the mental status of the person in terms of the thought. It can be the form of thought, content of thought, or what are the ideas, or what is the personality the person is. So before he got the morbidity, so what kind of a personality the person was. So you're going to collect the in detail assessment, that is a mental status examination that you're going to do. And you're going to do also the examination of the signs and symptoms when it comes to the conversion disorder, physical signs and symptoms. What are the signs and symptoms the client is suffering from? You're going to do the assessment for the clinical manifestation. So once you have done the nursing assessment, you're going to list down the problems of the client. So what are the nursing diagnoses that you can state, and what is the interventions that you're going to plan? So I've got few nursing diagnoses and the intervention. Number one nursing diagnosis is dysfunctional family process related to the dysfunctional behavior. So what is the management or the interventions for this particular problem? First thing is you're going to plan for a family therapy. So you're going to meet the family members of the client. So you're going to find out what is the reason the client is behaving in such a way. So what is the family support system that is available for the client? So you're going to assist, or you're going to meet the family members. You're going to do the assessment of the family. The next thing is you're going to teach the family to communicate clearly as well as honestly. So whatever the concerns or whatever the problem that the client is having in the particular family, even the family has to clearly communicate and honestly communicate what are the difficulties that the person is facing in the family. The next thing is you're going to encourage the family members to evaluate the communication pattern periodically. So what is the pattern that is followed in the family communication pattern? Since the problem here is a dysfunctional family process, very, very important that the family has to communicate with the client, as well as there should be a coordination association with the family so that the family as a whole can support the client, right? If needed, you can refer the family or the client to the outside agencies wherein they can get a holistic care. See to it that you reassure the family by providing the safety and the security. So since the patient is having this conversion disorder or any kind of a dissociative disorder, it is normal that the family will have the anxiety. So always try to, talk to the family and reassure them that this is what is all about the disorder and it can be treated, and see to it that you provide the safety and security for the family by giving the reassurance. So these are some of the nursing interventions that you can plan for the dysfunctional family process. The next nursing diagnosis is the ineffective individual coping related to personal vulnerability. So here the person is not able to cope up with the self-care, right? So individual himself is not able to cope up or to plan the activities for himself, right? So ineffective individual coping, not able to use the coping mechanisms effectively. So what are the nursing interventions that you can give? See to it that you can assign a primary nurse to a client. So who is a primary nurse? The nurse who delivers the care to the client from the assessment till the from the time the client gets into the hospital till the discharge, whatever the care or needs of the client is, has to be met by the primary nurse. See to it that the client is not always dependent on you for his, coping behavior. So sometimes you have to discourage the client for the dependent behavior that he may show. So you have to see to it as a nurse that the client should be able to make the decisions and should be able to solve the problem by his own self. So every time you help out the client or assist the client in solving his problem is not appropriate or is not appreciable. So at times it becomes necessary that you discourage the client for the dependent behavior. So that is nothing but you have to provide the positive reinforcement only when it is required. So you can provide the assistance only if you ascertain that the client is not able to deal with the situation, not able to cope up with the situation. In those situations that you can assist the client and give the positive reinforcement for the client. Help the client to recognize and feel good about the positive accomplishments that he had successfully achieved in his life. What are the personal qualities that he has? So, as a nurse, you need to identify his personal qualities. What are the achievements or the accomplishments that he had, done in his life, so that you can be with the client, encourage him, and you can give a positive reinforcement to the client by recognizing those values. Help the client to analyze the current situation and evaluate them. So, why is the client behaving in such a way? So, that insight that you're going to create in the client. So, always be with the client, help him to analyze the present situation, what it is, how we can deal with the situation rather than using dissociation or conversion. So, what are the better mechanisms that he can use? So, you have to be with the client, assist him in analyzing the present or the current situation and also to deal with it. The last thing, you have to teach the client what are the coping strategies effectively that he can use in his life. So various coping mechanisms at the time of anxiety or stress that he can use. So what are those that you can teach, right? So these are some interventions which you can plan when the client is with the ineffective coping ability, right? So as a nurse, it becomes very, very important to be with the client, give him the continuous reassurance, give him the time to learn, give him the independence, and also instill the positivity in the client so that he gains the self-confidence and accomplishes the problem-solving techniques in an effective way. The next nursing diagnosis is a disturbed personal identity related to lower self-esteem. So the personal identity of the person is disturbed because of the low self-esteem. So you can see it in the dissociative disorder. They would have had different personality, disorders. So what is the intervention for such a kind of a problem? Help the client to recognize or identify the various values, beliefs, hope, dreams, skills, and interests that he is having. So what are his values or principles in his life? What are the beliefs that he has? What are the dreams that he has? What is the skill that he is acquiring? What are his interests? So all these things that you have to make the client to recognize or identify, which will help him to overcome this disturbance in the personal identity. To know about his own self, you are going to make the client to get into the insight or the orientation to his own self, his values, his ideas, his skills, his interests. All these things are going to make the patient to understand his identity. Always use a therapeutic technique, that is the active listening. Even though the client's interests or values are not of your interest, but as a nurse you should be available to actively listen to the client's personal values and beliefs by being non-judgmental. So always make yourself available so that the client shares his ideas or thoughts, so that he will be able to identify himself as the right personality, right? So these are the interventions for the disturbed personal identity. The next nursing diagnosis is a self-care deficit related to dissociative disorder. So what is it? Because of the dissociation, the person is not able to take care of his own self. So it can be meeting the basic needs of the client or meeting the safety and security needs, anything. The needs of the client are not met by himself. So what are some of the nursing interventions? Encourage the client to perform some level of ADLs, activities of daily living, to a level of energy to her extent of ability. Whatever the client is able to perform, let the client do it and encourage the client to do it. And if the client is not able to, do the daily activities, you are available to assist the client to perform it. Whenever the client does well, okay, he does a particular activity or a self-care activity in a better way, be there to always give a positive reinforcement or a token economy or appraisal that he has done well. Demonstrate and discuss the ways to overcome the anxiety by using the various coping mechanisms. So when the client is there, maybe he is not able to do a particular self-care activity because of the anxiety or the stress, and demonstrate the various coping strategies that is available so that the client will be able to overcome the anxiety. If the client is having that severe level of anxiety, see to it that you administer the sedatives or tranquilizers as per the prescription of the psychiatrist. So these are the interventions for promoting the self-care needs of the client. Moving on so these are some of the nursing diagnosis and the interventions that you can plan for a client with dissociative or conversion disorder. So what is a geriatric consideration? So what is it when the client is an elderly client or an old age client? So how do you meet the needs of such clients, right? So a special population, we call them, so they are considered to special population, they are called as, so they require a special consideration. As usual, that you are going to do the assessment to obtain the history of the clients, to find out the cause, note down the clinical manifestations, and also plan for the treatment. So the treatment of choice that you can have is a group therapy or various other forms of the psychotherapy, so that you can bring about the insight for the client, right? So those special population, that is a geriatric group, should be considered in a special way so that their needs are different. Okay, they can be the self-care needs are different compared to a young adult or an adulthood person, right? So whatever the needs of such a group of the population is, has to be met in a special way so that they can also lead a normal stress-free life. Moving on to the follow-up and rehabilitation. So you're going to give a health education to the clients for meeting the self-care needs as well as the independence, right? So always teach the client to have an independent, problem-solving technique, coping strategies. Teach them the various stress coping strategies and how to manage the self-care activities. So that is what you're going to do in the health education. See to it that you also educate them to abstain or completely stop participating in the situations which seem to be very anxious or dangerous, right? Since the patient is having anxiety and stress in certain situations, see to it that the patient gets the abstinence from those dangerous or stress causing situations. Let him not face it. The next is the importance of follow-up that you're going to educate in terms of psychiatric treatment. It can be the medication therapy regimen or the psychotherapies that they need to undergo. Ask them to follow up at the time which has been scheduled for them and not to miss any of the follow-up visits. Encourage the client to develop the healthy behaviors. Through the behavior therapy, will the client be able to modify his behavior or the cognition or the negativity or the thought-stopping behavior, so that he can have a better coping mechanisms towards the stresses. So these are some of the follow-up and rehabilitation services that you can give. Right? So this is about the nursing management of the client with the conversion and dissociative disorder. These disorders are purely anxietal disorders which can be cured with the psychotherapy and use of some of the anti-anxietal drugs if the symptoms seem to be severe. Hope you all have understood the topic. Thank you.